had that opportunity to experience what it means life with chronic neck pain and life without. You know, I've experienced what it means to heal the rotator cuff syndrome in less than 2 months.
Wow, that's fast.
Well, you see, as the story goes on, even such things as the brachialis muscle tear, you know, or the grade 1 tears, how to heal that in a very, very fast way. You know, these things I've also had to learn up. You know, and then different methodologies for that. Also, and it's always a combination of a specific exercise, okay, specifically done specific exercise at a specific time with a pharmacochemical support, with the biologicals support.
So it's never just one thing, right? Like, oh,
never one thing.
Just exercise fixes it, or lifestyle.
And you need to have a program. You need to know that, okay, it's a particular pharmaceutical product you need to take at this time. After this duration, you do this, then you will get this effect by the next morning, because that's how it works. So use of the biologicals, whether like the cell extracts, you know, for the stimulation or the hormonal optimization. You know, I've tried for myself, figured out what is the best way how to make it work. How to combine it with use of the specific products from the realm of the cell therapy or the placental therapy, how to heal your joints. You know, what are the combinations, what are the approaches, how and when you do it, what is the frequency, you know, fantastic. That all was worked out as well. How to enhance and get rid of the fat, how to slim down. And of course, another very big problem is the uneven distribution of the fat, which is a problem for everyone, especially as you age and different types of the body. You know, different genders, they have a different uneven distribution. And of course, everyone, generally, we know that it is impossible to reduce weight, fat deposition in a specific anatomical area. You have to slim down generally. Yes, that's a fact. However, there are minimally invasive or non-invasive procedures, some of them are external, which you actually can improve them.
Like lipolysis and...
Well, like the lipolysis, you know, and then again, you just don't do the lipolysis. The lipolysis you do together with the other modalities. You know, you place them properly in one particular program. You know, so it's very important to have that programmatic approach.
Okay.
And it really makes wonders. It really makes wonders. You know, so I went through that transition, and where I found myself in the end of that journey, in the end of that particular period of life, was, if you put that in numbers, if apart from reducing my biological age and bringing that to 29 and the epigenetic test to 34 years old, other numbers that I can bring in is reduction or fat loss of nearly 50 kilograms. And nearly 50 kilograms of loss. There was 27 plus 8 is what?
27. 34. 35.
35. It's 35.
Yeah.
Yeah, well, if perhaps not the 58, it's about 40 to 42 kilograms of fat, at least.
Okay.
That was drop away from 127 kilogram to at 1.92.
Wow.
Burning the fat.
Yeah.
And managed to preserve and even regain maybe a couple of kilos of muscle. Okay? And when I stopped, I was at the age of, I was at a weight of about 94, 95 kilograms. And you have to understand that at that moment, what I've achieved was the autophagy. Okay, it was a real anti-aging and rejuvenation, revitalization on the cellular level, not only in the biochemical parameters, not only in the blood investigations, not only in the genetic tests, not only in functional tests and all, but it was a really profound, impactful effect, on the cellular level. Okay, that I've done, and I fixed a lot of many aspects in my life, starting from the pain-free life, practically pain-free life, in many aspects, unless it is physical pain induced by the exercise or the injury during the exercise. I've battled depression. That, trust me, there's so many men. They go through depression, and one of the reasons or the mechanisms of developing depression or the causes of depression is low testosterone level. It's hypogonadism. I've regained my cognitive function to a large extent. I brought myself back to that vigor that I had in my 20s.
Nice.
And the ability and desire to work, and it's something that I'm not proud of is the amount of hours that I sleep. It should be better. I always tell people that you should sleep better, you should go to bed earlier. This part that I'm doing now, it's not optimal. It's not great, but it is forced. I don't have other choice.
Do you have enough time to do all
I
that
have
stuff?
to put up with that. But I've found ways, and I'm managing to counteract all the negative aspects of that.
Through supplementation.
Through supplementation and other practices. And apart from that, it's very important that you have a proper mindset, and you have a proper mind-body connection and mind-body-spirit connection. And when you touch this topic, people think, oh yeah, meditation, some kind of spiritual practices. No, tried that. I tried meditation in the 90s, I tried Zen, I tried different types of it, like properly, like studied it with people, with the Buddhist preachers and the people who are actually the gurus, and
Didn't work for you?
No, it did not. Because what is missed out is the pharmacochemical component here. Brain is ultimately, it's just an organ, and it's dependent on the neuromediators. It has the whole neurological circuitry, different types of the receptors, and also you have to take care of that. You have to take care of, I'm gonna say something now which, don't judge me that it's too simplistic, but I just want to make it quick and simple. You have to be able to detoxify your brain, okay, of the metabolites and all, and you have to maintain the supply of the protomolecules to produce your neuromediators, and it's absolutely important for all aspects of life and all rhythms or transitions in a day, so to modulate your sleep, to modulate the REM, to modulate your ability to wake up, to fall asleep, to maintain sleep, the REM, to wake up, to be fresh, to regain your cognitive function in the morning. And tell you more, it's not only a balance of the neuropeptides, you have to balance your hormonal profile at the same time, with the prolactin levels and so on and so forth, so there's so many aspects in this, when this is a truly holistic way.
Which is, I think, the key takeaway for us, this evening as well would be, again, there's not one thing that fixes everything. It is a system. It is a very structured program, like what Dr. D says, where it's not just only supplementations, it's also exercise, right? It's also, I think, lifestyle modification at some point as well. You put it all in a very neat package, and that's the reason why we are having this Meet the expert session, because it's important that people out there, like all of you who are watching, need to know that it's not a magic pill. You pop it in and boom, everything goes. But rather, it's a system. You need to follow
purposeful
it.
system.
Yeah.
Purposeful system.
And you will
Where every
see the
component
results.
has a purpose.
Yeah.
Why you do that? For how long you do that?
Yeah.
What you gonna do after you achieve this result? And also, that is my vision. That is that's passion and dedication, and I believe the group of people that we all work together. We're sharing that.
Yeah. Yeah.
And another very important component is that it's a very dynamic system.
Correct. It changes based on, again, the reports that you get, right? When you run certain tests in
It
your
changes
body.
based on two factors, because of the information that we're gaining more and more every day.
Correct.
There's always the input data. There's always data from other sources, what other people have found. And you have to take that into consideration, so it's evidence-based. And secondly, of course, you have to understand the nature of the processes going on inside a specific human body of every specific individual. And you have to look in all aspects of life and just calibrate it, modulate it, optimize it. And miracles happen.
Yeah.
Literally, miracles happen.
Correct. Imagine that a body free of pain, that you've been living with, throughout maybe your working life, right? Especially what we call as a urban dwellers disease, because of sitting in chairs for 8-9 hours, sedentary lifestyle, poor food choices, and nutrition.
And then you modify your digestion. You are not miserable anymore with your digestion and with your the function of your gastrointestinal tract. Okay, you are not miserable because of your reproductive function. You're not miserable because of your forgetfulness or because of the poor quality of sleep or inability to focus or concentrate. It really matters a lot.
Correct.
And as we age, I believe we begin to value these things more and more and more. And when you have a chance of regaining some of it, nothing can be more rewarding than that.
Correct.
Isn't it?
Correct. Remember this, you are your body, your body is your biggest asset, right?
Right.
It gives you the comfort, it gets you your income, it gets you your goals that you want to achieve in life. So if you don't invest in your body and in yourself, what do you invest in?
You have to take care of that.
This is your biggest asset, right? And that's why, again, these sessions serve as gentle reminders to ourselves, that start looking into self, start being more attentive to what your body needs and give it what it needs, and get the results that you want. The last thing you're gonna do is to spend, thousands and thousands of dollars or even more than that, or even hundreds of thousands and not getting the results that you want.
It's totally fine to spend. That's what I've figured out for myself if I know that I'm gonna get the result.
Correct. That's what we all want. Yeah. Oh, great. So thank you so much for joining us today. Stay tuned for more of our sessions that's coming up in the near future. All right, we love coming up with content like this. Thank you so much for joining us, Dr. D.
Great to be here, and thanks for everyone who's watching that, and many more to come. Stay healthy, be alive, have fun.
Yes.